What's the best measure you can do if you want to live well to 100? We studied people that lived over 100 years of age, and there's two very key things. One is staying physically active, and the other is being surrounded by an engaging community. We're going to talk about activity, and when it comes to physical activity, there's certain parts of your body that are really important. Your knees, hips, shoulders, and your low back. That almost everyone has had low back pain at some point in their life. You may not have had knee, hip, and shoulder pain, but it's pretty much guaranteed that you've had low back pain. But if you are having some low back pain, just go to the drtom.com/YouTube. And the Lazy Susan exercises are the safest thing that you can do in your home to rehabilitate your spine. The Lazy Susan exercise. You can find that on our YouTube channel. But getting back to knees, hips, and shoulders, the best exercise that you could do for your immunity. And it's exercises where your wrists go above your eyes, they go above your heads. Moving your shoulders above your head in gentle rotational flexion and extension will help you remain active into the later years of your life. You really want to focus on the knees because those legs are what carry you through life. And if you're not active on your legs, well, then you're going to be hand walking everywhere, or you're going to be in a wheelchair pushing the wheels around. When we experience knee pain, it's a very, very common thing, and it should heal on its own with a little bit of help that I abbreviate as RICE, R-I-C-E. This is rest, mobilization, letting it not move around too much, putting some compression on it, icing it, and elevating it. It will typically heal in about 3 days. Now, if you don't have healing in 2 to 3 days, or it goes for 2 or 3 weeks, then you have a problem. Part of the problem is that the cartilage inside the knee joint is the most stubborn tissue for regeneration. And that's what we want to do, is we want to regenerate that injured tissue. And if we let it go on more than 3 weeks, 3 months, God forbid 3 years, then we usually start knocking at the door of the surgeon. There are lots of options for getting a knee injury healed. And I want you to take a look at some of the things that we do in the clinic here. First of all, first thing that we do is we ultrasound the knee. We look at what's going on inside of here with a very simple, non-invasive, not pain-creating, no radiation, just sound waves, just a little bit of a radar going into the joint and looking around. The other thing that we can do is we can do some simple injections that rejuvenate the tissues on the inside. They stimulate your own tissue to grow back. We call this platelet-rich plasma. It's real simple. We just draw a little bit of blood out of your arm, we centrifuge it, and there's all these different layers that appear, and then we re-inject that into the area that wants to heal. Well, there are elements in the blood that do that. In fact, the blood is loaded with growth factors, and these growth factors actually modulate or balance the immune system. And in fact, that injection, that procedure is practically painless, it's completely safe. We're not putting anything into your body that wasn't already yours, and so there's absolutely no risk of allergy. Try not to let yourself get to 3 months of knee problems. Get it healed in 3 days.
Everyone started noticing that I'm much energetic and feeling positive.